The Project. Kuwait. Learn. Live.
Hey guys, how's it going? So in this episode we had Mohammed Ajialabi. So he's a physiotherapist out of Bahrain, and he came to come and see us on one of his little short visits over to Kuwait, coming to see a few of his clients, and he talked to us a little bit about his perspective on the physiotherapy and for elite athletes.
For me, personally, it really struck close to home because he was talking about people that sit down all day and how the communication between your brain and your muscles starts to deteriorate after a while and how you can kind of reignite that. So I think that was a great tip that he gave during the show. And the whole aspect on breathing, man, like that was...
Yeah, he gave us some really, really cool exercises actually to help increase your breathing, and actually from your breathing, then increasing the performance in the rest of your body.
Yeah.
And he also actually has a little bit of a go at dry needling.
Yes, he does. Something I love. It's my Panadol.
So, yeah, have a listen to this one and enjoy.
And if you have any questions, DM us and let us know.
Yeah, for sure, guys.
All this and more in today's episode.
But I'm pronouncing his name
we're
wrong.
on anyways. I'm going to pronounce his name. I don't want to pronounce his name wrong either. All right. So it's... Let's see if I get this. Ajialabi?
Mohammed Ajialabi.
Ah, all right.
There we go. I was going to get that right, to be fair. I got right,
thank you. Well, I'm going by what you guys put on the show notes. Like, I was like, I don't go by the Instagram. Like, I saw the whole profile and everything and did my research, but it was like, can't find the guy's real name.
It's my fault, to be fair, because I shorten everyone Mohammed down to Mo. Just because it's my bad. It's my bad. It's me being rude. So I apologize.
Trust me.
I apologize. So, Mo. Mohammed, obviously, you're a physiotherapist or a physical therapist?
It's a physiotherapist.
Physiotherapist over in Bahrain. So a few of our listeners already know you. But for those who don't, do you want to just introduce yourself and how you kind of got to where you are at the moment?
Well, my name is Mohammed Ajialabi. I'm a physical therapist from Bahrain. My career started 10 years ago when I graduated from the university. What got me into physical therapy is basically, I was young. My mom was having back pain, went her to the doctor. It's literally took her 2 minutes to get diagnosed, and then voila, she's out of the clinic. Going where? To the physical therapy. I've seen the people and how the physical therapist was really into treating her, and the communication, the contact, and the things, how the relationship has built in between the therapist and my mom, and the time she has spent in there till she got better. And I've seen that, wow, this is really great message to deliver to people. Treating the patients, getting them better, no pain, and as well as there's a human touch in the picture. This is what really has given me the insight of what I want to be in the future. Graduated from the university and looked at the market and says, wow, there are so many athletes in there. I wanted to play sports when I was young, but because I was looking at the book literally for most of the days. So I didn't get into a real sport back then. But I said, well, I want to do something I want to enjoy and I wanted to always to do. So taking care of people, any sports. And that's what got me today.
Yeah.
Being majorly in treating athletes, all kind of athletes.
So have you always been based in Bahrain, or have you been based anywhere else to start with? Or?
Well, no, I've studied in Jordan, went back, and then based in Bahrain. Well, I started working in the major hospital in Bahrain back in 2010. Then started with my first job in a football club called the Najma back then. It was back in 2009. Yeah. So 5 years later on, with working in the morning in the major hospital back in Bahrain, the Salmani Medical Complex, and with the sports clubs, I came to realize I need to step on with the game. So I joined the private sector in the afternoon as a joint physical therapist with one of the hospitals back then. And after 3 years, I said to myself, it's now to have my own place. I wanted to provide and put my own philosophy into the game, into the picture.
Okay.
I want to treat patients by my own rules, by my own theories, by my own touch.
Yeah.
And with no interruptions from, hospitals, management, stuff like that. Sometimes they put you in certain angles that you cannot break. So I said, well, let's just start something. I need my own place. Then comes the time that comes for movement came to the picture. I said, well, the place, I need to call it something that I really like. What is missing in the market? I need a catchy name. Resembles what I like to do. Is to let people move well. and move in the right way. And then comes what brings the name into it, movement. And then I started my own clinic 2 years ago, and this is my going to the third year. We just celebrated our coming third year of our clinic.
Congratulations.
Thank you.
That's amazing.
I hope it keeps going for a really long time.
Yeah.
Well, you're doing a lot of good work. I mean, I've seen you, mashallah, I've seen you here in Kuwait a lot. Can I go in Arabic a little bit?
Yeah.
لا يعني وايد اشوفك هنا بالكويت ما شاء الله عليك واشوف يعني انت قاعد يعني ما شاء الله قاعد تشتغل مع المحترفين اللي عندنا. I'm saying he comes to Kuwait a lot and he works with a lot of the pros here, from CrossFit boxes to the MMA fighters. So I mean, when it comes down to movement and الحركة هي شيء يعني.
What's funny about seeing me in CrossFit competitions in Kuwait, I work on the ground, on the benches, everywhere.
Yeah.
Just give me the athlete and right on.
Yeah.
I start working on him. So I don't need fancy stuff to work. So you'll see me on the ground, you'll see me on the benches, you see me everywhere.
Awesome, man. That is awesome. It's good to see someone. It's good to see someone like that.
I really like the action, man. When you see the athlete and you want to take him back to the next heat as soon as possible. And coming after that, the previous heat, like shattered and on the ground.
I literally always see him, like literally in the athlete area, like going from guy to guy, just like, okay, sort this out. Okay, do this. Okay, now do this. Running between everyone. He's always like switched on.
Who are some of the bigger guys that you've worked on here? Like, who are some of the hardcore dudes? Like, some of the famous people, I would say.
Well,
like famous.
There's some names out, man.
I worked with Coach Yusuf Al-Baksami himself.
CrossFit Kuwait.
Yeah,
he's awesome.
He's such an amazing human being. Honestly, I really love this guy.
Yeah. Puts out great information too.
He
really puts out.
He's
really
amazing coach. I really got the chance to work on him and his athletes as well. Salim Al-Fadal, Mohammed Budarwish, the nutritionist.
Oh yes, yep.
Yeah, many of his athletes, all of them probably.
Oh, that's cool. That's awesome.
It's amazing to get into a new world. Well, people from abroad, not just from Bahrain. I got the chance to meet people from neighboring countries and expats, and I get to meet Liam.
You.
I am lucky. Trust me, I am lucky.
So here's a question for you: when you cross from Kuwait to Bahrain to all the countries and everything, what are some of the most common injuries that you see? And are we going to pigeonhole into CrossFit, or are we going to branch out? Like, I'd say for the Arab population, I want like for the Kuwaitis, for the locals in each area. Do you see common injuries that
back pain, man?
Back pain? How? Back pain. Why is that? I had a physiotherapist say that we were just, like Arabs or Kuwaitis in general, that we have a hyper flexibility that she hasn't seen compared to people in the West. And I'm wondering what another physical therapist.
Well, to be honest with you, it's just the lack of two things that I see that brings back pain. The core being inactive and improper breathing.
Okay.
So we sit most of the time. Yes, we do have the advantage of sitting on the floor, which is give us a good mobility to the hips.
Yes.
So we can cross legs easily. You see people from Europe, sometimes they cannot cross legs.
I can't cross my legs.
Yeah.
While sitting on the ground.
I can't cross my legs.
For a lot of people, like who like have awful mobility, like if you put them with a barbell or anything like that, and then they sit down and they're like, boom, straight down. Like no problem. They like sit cross-legged or sit like on their knees, obviously, like for prayer time and everything like that. Completely fine. And actually, like you would not see that in the Western world. Like usually, if someone is immobile, they're immobile.
Really
they're literally like steel rods put together. Like, but yeah, here it's like obviously there's a few different movements where actually completely fine.
Yeah, exactly. So most of the people growing up got to get grown sitting on the ground. So that kind of give it a relative mobility. But when they come to squat and they lack the squatting, that comes to probably different aspects that they lack, like core activation, ankle mobility, not the hips, and glute activation, obviously. If you sit on it, you lose it. That's what they say.
So I have a question for you, since you brought that up, not to cut you off. Now, because I sit at a desk all day.
Yeah.
All right. So let me give it to you from the perspective of a desk jockey, so to speak, that is physically active. I'm in CrossFit. I do all of that, trainer, all that stuff, been a trainer and, been a coach. Sitting down all day switches my legs off.
Yeah.
And what can I do to switch them back on?
All right. Now we're talking about the time that you work out versus the time that you sit on the chair all day.
Yeah, like
There's no
I
proportion.
I sit for 9 hours, drive for 3, so I'm sitting for 12 hours. Then I go to the gym at 7 o'clock at night or 6:30.
And you work out for 2 or 3 hours.
No, I'll
max.
work out for an hour. Like I'll get my hour workout in, but if I'm doing heavy squats, I can actually feel it. Like I'm like my legs are just not waking up. I'm just not.
Of course.
It's like a short switch.
Because you've been sitting on it for the past 13 hours. So you need to prepare it before you hit it.
Okay.
So you need to prepare your legs before you start squatting. So we're talking about if you sit down, what literally happens is that your glutes get shut down because they're not in need. All right. You're passively sitting on a chair. So, if you look at the people, our ancestors, they used to always squat, especially in the Asian world, Arabic word. They used to squat waiting for the bus. They used to squat using even the toilet, the Arabic toilet.
Yeah.
So being put in a squat position is really normal for a human being since birth. Now, if anybody sees a child, they sit effortlessly, in a squat position. They can spend like half an hour, not even feeling pain or feeling, that they need the urge to move or do anything else. They sit and play with the toys in squat position, and it's really perfectly normal. We lose that kind of ability the moment we go to school. School says you gotta sit down on the chair. You should not move for that subject or for that period of hour. And then that comes that seconds break between one class and another class, and that is not enough for you to move. And then comes the second class, and you're gonna get sitting back again.
You lose all your mobility. You lose everything.
You lose mobility, and you lose that muscle activation. And then comes the university, etc., etc. People does not work out. So many people nowadays. So you lose that glutes activation while sitting for a long time. You need to get them active by, move often and move well. So I say if you're sitting down for 7 hours at work or 9 hours, so you got to time up yourself that you move every half an hour.
That's what I usually do. I'll typically go into a lunge or a squat, mainly a lunge, so I could try and stretch out my hip flexors a little bit. Because that's what tightens up. Like that's what
the driving. I think like hip flexors.
Oh my
gets
God!
super tight because your knees sometimes are a little bit above your hips as well. Yeah. So actually, you're really.
That's why that's what it's from.
But I'll tell you something. You're going to be amazed. Sometimes the hip flexors are tight. It's not because it's strong. Sometimes because it's weak.
Yeah.
So you gotta find out if it's weak, you gotta strengthen up.
Yeah.
Because if you stretch a weak muscle, you're just gonna create that nerve feedback on making it shorter. Imagine.
Okay.
All right. So if you stretch out your weak muscle.
I know, right? Yeah. Like listeners, pay attention to this part.
This is a big one.
You gotta get assessed before doing anything, not just a hip flexor stretch. Because if that muscle ordered by the brain to get shorter because it's weak, well, let me put it in that scenario. We cannot move unless first we breathe well. If we don't own our breathing, we don't own our movement. Okay, this is very important. Second, we got a group of muscles that surrounds the spine. It protects it. So if the spine is protected, you can move. If the spine is in jeopardy, some muscles will be around tight to give the brain the sense that the spine is preserved. It's safe to move. So you got the glutes, you got the pelvic floor muscles, you got the diaphragm, which is a major breathing muscle, and you got the core. And we're not talking about sexy six packs. We're talking about a muscle called the transverse abdominis.
Yeah, it's like your internal weight belt, right?
Exactly.
Yeah, there we go. I've done a little bit of research on that.
Hello.
I know, right? That's for my certification, right? That's one thing I remember is like don't wear a weight belt because then you weaken your transverse abdominis.
You got to earn it.
That's true. I mean, you're the expert. So
yeah. Well, if you have a passive stabilizer, anything like a brace or a belt, your internal stabilizer shuts down immediately.
Okay.
Because the brain is economical. It tells you, well, I cannot spend so much energy on a muscle activation because it needs food energy. And you got some passive stabilizer from outside. So I'm going to shut down the one inside because I cannot spend that much of energy on it.
It makes sense. So is it actually advantageous to the athlete to, so to speak, squat? When I squat, I only put on my belt when I hit like 320.
Yeah,
that's
exactly.
That's when I'll put my belt on because I get like an extra 30 pounds out of a belt. I don't know if it's mental.
No, it's not mental.
So it's not.
It's not mental.
People thought I was crazy, man.
When you hit,
I thought you were crazy.
A couple of other
no, definitely.
I can't name names. I can't name names.
You definitely get extra poundage out of a belt. Like if you use it correctly, like you have to breathe correctly when using the belt.
True.
Which you'll probably be able to talk about.
Yeah, of course. Now we're talking about. Now we're talking about heavyweight lifting. You have to have that trunk support to lift it, but you have to teach your core to get active going through that weight. So you don't be an urge to use that belt when you're using like light to moderate weights. You got to earn that core activation. So why we wear the belt with the heavyweight squats? Basically, you need the spine to be stable while squatting. So even the breathing technique. Now you've been to the recent seminar in China.
Yeah.
So I'm sure they talked a lot about how the core should be stable while squatting with heavy when you breathe in, when you breathe out, going in descending and ascending.
Yeah.
So you have to have that spine stable. How do we get that spine stability? When you hold your breath, there's the air pressure that is inside your lungs is going to push out the whole trunk. And that pressure created inside your trunk is going to stabilize your spine while squatting. So with the heavy weights, the breathing itself is kind of not enough to stabilize the spine. So you need to have that extra support in trying to preserve the spine.
Yeah.
But if you wear your belt on early stages, you're just going to lose that core activity. So we better.
So you're effectively switching it off, and then
yes, exactly.
As soon as you take your belt off, then actually like it's part of your body that isn't as switched on as everything else. So almost if you've got exercises to do after that squat, then that's going to be compromised. That's not going to be as good because actually you've got like the whole of the middle of your potentially where you're wearing the belt is effectively not going to be activated. Is that correct?
The whole trunk is going to be inactive.
Yeah.
If you just used to wear the belt with squatting.
Yeah. So all those guys wearing their belt with their names on it are actually doing themselves a disservice.
Yeah.
Yeah. Oh, I had to say that.
But I mean, I guess like sometimes, for a bodybuilding side, like from something I heard, like a rumor that people would wear their belt so that they would stay inactive. So then they would actually keep a really slim waist. So actually, like they would wear their belt the whole time.
I thought it was marketing, man. Like they just have their name on the back of the belt.
So they wear a belt the whole time, like so that actually they kind of their abs don't get. Like,
I
they
know
don't
what you're talking. Yeah, it's almost like they'll try and treat it like a corset, like a corset, so it holds the.
Well, because obviously the illusion in bodybuilding is better to have a tiny,
like the saran wrap around the waist.
Yeah, man.
To be honest,
I stopped doing that a couple of years ago.
Only a couple of years.
Only a couple of years. My six-pack speaks for itself now.
The six-pack is not everything, trust me.
I wish I had.
I've tested a lot of people with six-packs. They just fail that test of checking cores.
So glad you're saying that right now. Dude, I love you, man. You're awesome, dude. You are awesome, dude. Seriously.
I completely agree. Like, I've been leaner than I am now, but recently I've been doing a lot of work on my core and actually doing core work. Because before I thought, heavy squat, I'm okay. Like a heavy squat, heavy deadlift, I can hold up like however much on my back and like it's not going anywhere. But then actually like I try and do any rotational work or anything like that. And I'm like, my core is lighting up. But I thought I was strong. And so actually been missing a big section of that.
Exactly. Now, I've seen a lot of athletes with neck pain, shoulder pain, back pain, all kind of joint pain because their core is not stable. Well, proximal stability works for distal mobility.
So you have to explain that.
Okay.
Yeah, dude.
Let's explain that.
Like I'm sitting here, it's knowledge bomb after knowledge bomb, and then I'm like blank.
So we said breathing first.
Yep.
Then core stable. If the core is stable, you would have a good joint movement all over your joints. So imagine you lack that picture, the core stability. The joints has to have that extra work somehow. The body works by all means. So if you have to lift that weight, if your core is not active,
it will find a way to do it.
It will find a way to do it.
Yeah.
But then keep continuing that, you'll create a
default movement pattern.
Pattern.
Yep.
And then that is going to end up with pain.
Yeah.
So if one of the great therapists said the pain is a sign of change. So whenever you have a pain, you know that in your movement, there is something is lacking. So you need to fix it. You need to figure out what it is. So core stability, man, is very important. So whatever you have as a joint pain, it matters but you have to have your core stable before fixing that. Because if you're just going to fix that joint pain without making sure your core is stable, it's just like fixing a crack by painting it over.
Yeah.
Not fixing the real crack. We're not working on the source. So I've seen a lot of therapists working on athletes. The dry needling, man. I really hate it.
I love dry needling, man. That's like my Panadol. I haven't taken a Panadol in a couple of years now, and dry needling's like, I'm just like, all right, stick those needles in me, man. I want that euphoria. I want that pain to go away. And like, it's my physical therapist, the one that I see in Kuwait, she actually left, and she was pretty good. And she used to dry needle and give me the corrective movement patterns to go by.
Now
I had 2 torn labrums. Okay.
Oh, okay.
I tore this one. 3 doctors said I needed surgery. Doctor in the States. Yeah, that's what he said. The doctor in the States was like, look, man, I'm going to give you a cortisone shot. Here are your exercises for 3 months. Swing a baseball bat and tell me how it feels. If it's still really bad, then maybe you need to get surgery. But otherwise, always go the route of physical therapy. And now they always want to make money in the States. But, I really appreciated it because that was the answer that I was really looking for. Because my physical therapist said, you don't need surgery, physical therapy. But all the doctors here in Kuwait were like, no, surgery, surgery, surgery. And my friend that had surgery, his mobility went to crap afterwards. He couldn't get his hand past his head. Whereas now, like, I'm going past my head, alhamdulillah.
Alhamdulillah. Knocking on the wood. Well, let me tell you something. You're not as broken as you think you are.
Okay.
Yeah, because I've seen a lot of athletes. And let's talk about CrossFit Games athletes now. You think they're not injured? They have millions of stuff over there, but they're just functional and they're working. The body adapts after some time and doing certain movements without pain. You just have to have that time and a proper rehabilitation and a proper commitment into the plan so you'd get over the overall picture.
So real quick, sorry, just to take us back so we can take away something from the core work.
Yeah.
What are some of the recommendations you can make for core work? Well, I just want to backpedal there before we get started on a different topic, like the core work.
Definitely.
We talked about like how detrimental not having a stable core is, but what are some of the key exercises in your opinion? And maybe some anecdote that you would recommend for athletes.
I would say
depending
first,
on depending on them in general.
I would say first start with the breathing. Learn how to breathe well, because the diaphragm is one of major spine stabilizers, and it's a major breathing muscles. So if you work on proper breathing, now you kind of solved half of the problem. Well, to activate the core, people understand that the activation means like a heavy work or so much of an exercise that you have to do. This is not the solution. To activate a muscle, you need to switch on the brain. To switch on the brain to find that pattern and to activate that muscle that has been sleeping for a really long time. And that does not work by doing a heavy exercise. It happens by repetitions, because you have to teach the brain how to activate it. And as much as you do it, the brain will do it, and it will finally end up having that muscle activated by finding that pattern again, how to switch it on. You ask a lot of people to stress that transverse abdominis muscle to switch it on, and eventually you'll see people sucking their stomach in, pushing their stomach out, not being able to activate that transverse abdominis muscle.
Yeah.
So just asking them to do certain movements like, be on your hands and knees, draw your belly in while breathing out or breathing in. And after some time, they will get the picture. Doing planks, and not like staying in plank position for 1 minute, Just get into a plank position, then go down on your stomach, and then go there for 1-2 seconds, and then going down. This is just eventually going to switch on your core.
All right, so turn it on, turn it off, learn how to turn it on, turn it off. That makes sense. That makes a lot of sense.
With the repetitions, the brain will find its way to switch it on. Now, people sometimes say, I cannot feel that my trunk is active. Yeah, because you've done that exercise for 10 repetitions, and you want to try to squat a heavy weight, and the pain is still there. It needs some time. The brain to adapt on switching on that muscle.
It's creating the neural pathways.
Exactly.
Right? That's it. All you're doing is recreating those neural pathways that used to be there, but you switched off through sitting and whatever else. That makes a lot of sense. I was squatting at work. I was getting up after every half an hour. And what I would do is I'd do a prisoner squat. So I'd put my hands behind my head, activate my thoracic spine, get all of my back really tight, pulled down. Man, I was squatting. My squats were like butter after that. It made a huge difference.
See?
And it makes sense because I was recreating those neural pathways that was turning my legs on, my back on when I'm squatting.
Exactly.
Wow, dude, man, this is awesome, dude. Like,
And it
this
doesn't-
is like knowledge bomb after knowledge bomb, man.
Thank you. And it doesn't need weights or barbell to squat with to activate your core.
Yep.
It's just you do air squats after that. And
I think that's what a lot of people get misunderstand about. They kind of think, okay, like I need to fix myself. I need to do more training. Like what else can I train to do? What else can I okay, do I need to do more heavy squat? I need to do more actual physical training, when sometimes it's more physical therapy, I guess, isn't it? And sometimes it's more that, okay, lying down and going, okay, how am I breathing?
True.
Right? And going, okay, can I control that or can I not? I mean, one of my athletes the other day even asked me, hey, you can control your breathing? I was like, yes. Like, can you not? And then a light bulb went off in my head and said, okay, actually, like this person doesn't know how to control their breathing. And actually, if this person is trying to do like high intensity exercise and doesn't have even an idea that they're able to control their breathing and like kind of maybe just take deeper breaths and slow themselves down a little bit and relax the body in that way.
True.
Then like
it releases a lot of happy hormones if you breathe well.
You're right. No, you're 100% right. I mean, there's, what's his name? Was it Wim Hof? Is it Wim Hof, the Wim Hof thing? And like when I play baseball a lot. So when I was a pitcher, when I pitch, one of the things that pitching coaches always say is breathe. Breathe. And when you do breathe, you get it down into your gut. You breathe it all out. This sense comes over you, and it's like, oh, there it is. Like there's what I was looking for. So yeah, wow.
And I kind of like to do it like in the ice cold plunge pool. So I'll practice I'll do box breathing. So I'll take like in for 10 seconds, just a count in my head.
Yeah, exactly.
Maybe out for 10 seconds and then kind of go to like maybe when I breathe in, holding my breath in.
That's it.
And then out.
Exactly.
Hold it out and just kind of like counting in a kind of cyclical fashion like that. And
Sure.
like you do get a kind of euphoria of like having control and like so relaxed and everything.
Sometimes you get even dizzy and you see butterflies.
Yeah, completely. And I went from the ice cold plunge pool and I was kind of completely fine, like very awake but very like euphoric. Went straight into the jacuzzi and I was like nearly falling under the water. I was so relaxed. And it was like everything I felt all my lungs was like nice and expanded. The air was actually like pushing out. I could feel like I could actually breathe properly rather than being so tense in my shoulders.
Exactly.
So, yeah.
Just a public service announcement. Liam has built up to going into cold plunges and into that stuff.
No, get yourself in there.
No, dude, the first time I went into talking about breathing properly, second I went into a cold plunge, I was fine for the first like 10 seconds. I got out, went into the jacuzzi, did all my stuff. When I went back in, I was like, you have to take that deep breath.
Sure.
You really do.
Yeah.
And I just swallowed so much water that I was choking. And I was like, all right, I'm done here. So, like that's why I'm saying public service announcement, dude. It's really hard.
Putting your head underwater, that's a public service announcement.
Like when you put your head underwater, dude, it wakes you up.
Yeah, it wakes you up.
It woke me up like I was like alert.
Yeah.
I was really alert. And it heightens your nervous system.
Yeah, because you think
and
you're
then
dying.
the heat suppresses your nervous system.
Yeah, like I kind of, when I'm in there, like I'll be standing in there and it kind of gets water to about chest height. And then I kind of like go down to neck height and then I just take one dip with my head under the water. Like I can't be staying under there or like spending too much time there. Not at all. But I do take like cold showers and I practice my breathing in a cold shower if I can't get to the plunge pool. Things kind of like that. Because, yeah, you do kind of go straight in and you go... Like you take that big, like your body kind of goes into like kind of like trying to like fight or flight mode a little bit, doesn't it? And if you can control that, I think that's kind of a good step for a lot of listeners to be able to kind of go and use a cold shower and kind of control your breathing immediately from that cold shower. And I like, correct me if I'm wrong, but I find that as a really good technique for actually starting to gain control of what's going on inside your chest.
It's very correct. It's true. Exactly.
Yeah.
You got to work on your breathing. Definitely. And the way you're done it is just perfect.
Yeah, I just think that's a really easy like takeaway for people because a lot of people don't have an ice cold plunge pool.
Yeah, just take a cold shower.
yeah, but like it's before or after every workout, like just go for nice warm shower first, and then before I get out, like chuck it on cold.
Here's the thing though, after I work out, cold doesn't work for my body. Like I think it depends on your body because cold does not work for me. Heat, I have found heat to be like my numero uno to kind of go to when I'm hurting. If my back's hurting, I'm taking a boiling hot bath with some Epsom salts, and I feel great afterwards.
I think the Epsom salt is the solution.
It could be, but when I go into a sauna after a workout, I am less sore the night of and the next day and the next day. Like the soreness isn't there in my lower back, especially my lower back.
Yeah.
And for me, I think it depends on your body. Like I honestly
I would say contrast bath. So spend 1 minute in the heat and then go into the cold.
No, man,
I was just going to say that, like, in one of the gyms in Kuwait, like, it's really useful. The sauna is right next to the ice cold plunge pool, and you literally can just go straight between. And actually, like, try and spend like an hour a week at least, just kind of going like just back and forth,
which
like,
makes sense. I mean, it depends. But it depends on what your resources are. And it depends on. We got the whole gang joint.
Yeah, we got the whole photographer gang.
I know we got a bunch of photographers here right now. I mean, if we knew this, it would have been D&E time, man. But yeah, no, I think it depends at the end of the day. That's just my opinion. But you're the expert.
As easy as sleeping down on your back. If you don't have the stuff, if you don't have the privilege to get the access, just spend the time sleeping on your back, bend your knees, put two hands on the chest. Make sure you're expanding your chest while breathing in. Okay, hold that breath and then exhale till you lose all the breath, and then hold it and vacuum that stomach in for a couple of seconds.
Vacuum of the stomach as well.
Yes,
yeah?
that works the diaphragm.
Okay,
this is one thing I've learned. It's one good technique that I've learned from one of my friends. His name is Ruben Garcia. He's a movement therapist in Kuwait.
Yeah,
he's a really great guy. I get to learn a lot from him. He's amazing. He just showed me how the way he's doing it, and it's perfect. It works really well. I even tried it on myself. It's amazing. So back on your back, close your eyes, breathe in 5-6 seconds, hold 5-6 seconds, exhale till there's no air, suck in your stomach. There you go. The diaphragm don't dooms. If it dooms, it gets active. A couple of times, and you'll see like you're really more upright. Your shoulders kind of retracted back, and you're more of control on your breathing.
So with that, actually, here's a question for that too. When it comes to, you work with MMA fighters.
Oh yeah.
So now breathing, I'm assuming that's a crucial role right there.
Staying alive.
Now, talk about the MMA a little bit, and some of the movement patterns that you see there, and the breathing technique that's required. Because I'm assuming it's a different breathing technique, right? It would be a little bit different from a CrossFitter or an athlete that's going to lift a heavy amount of weight.
Oh yeah. Well, a quick shout out to my colleague and a friend, Dr. Abdullah Al-Jodar. He's a orthopedic and a sports surgeon. We teamed up with His Highness Sheikh Khalid bin Hamad Al Khalifa mixed martial art team. We take care of the athletes. When it comes to surgical part, he does his job, and when there's a physical therapy in need, I show up. So MMA, you're talking about all kind of injuries that you can have in mind.
Imagine. I can definitely
breathing
imagine.
is really crucial. They lack the breathing, honestly, the proper breathing. I was having that idea of taking 1 or 2 sessions with them and to teach them how to breathe well. And this is going to happen in the process of the next couple of weeks. We're going to sit down and talk really about it and see how they're breathing. I get to notice a lot of slouching and being in a kyphosis.
I was just going to ask about that. I was totally going to ask about that. And I was telling Liam the story earlier. We had a kid who was a boxer. He's 16 years old, came and played a game of baseball, and he couldn't get his shoulder above his head. Ball hit him straight in the eye.
Ouch.
And it was like, it was an unfortunate situation, but he was down here. He could protect himself. He could swing a bat well because he was, doing this.
Yeah.
But, he just did not have that mobility to get his arms up. And it was, that you must see that a lot with fighters.
You're talking about jiu-jitsu guys, MMA guys. It's always the same thing. Head overhead, like shoulders overhead, is mostly lacked because of always being in the protective phase, trying to protect their phase. And there is no counter movement when it comes to training strategies, because they don't counteract that movement in the training.
Yeah.
Because they always focus on getting better at the game just by drilling. And they work on their strength and doing gym stuff, and they get tighter and tighter.
Yeah.
So no mobility most of the time. So it's very important and crucial to, counteract that movement, the fighting movements, which is basically always protection, into working and activating that back line. We're talking about calves, hamstrings, glutes, back, and neck.
So like the posterior chain
muscles.
So because I see a lot of the guys who are obviously they're slouching forward, like they're slouching forward a lot. Like for those guys, like what are the kind of main movements? Is it strengthening the back, or is it kind of mobility from the chest to open that up?
It's both, actually.
Both, yeah?
Trying to make sure that to relax the anterior line of muscles versus strengthening that posterior line muscles.
Okay.
Because they're always into forward flexion position. They're always covering their face and their trunk.
Question about that, because I've had a lot of physiotherapists say, oh, you have tight pecs, you have tight. And this was back when I was doing like the bro split with the chest flies. And, they're like, oh, your pecs are so tight. Your pecs are so tight. No, you shouldn't be doing more, chest work. You shouldn't. But when I did a chest fly and I opened up, man, I just felt great for like 2 or 3 days. I just walked taller, and it just felt like that weight just kind of brought, you know what I mean? Does that make any sense? Like,
you just had a great pump, man.
No, dude, but it's different. It almost felt like my chest cavity was opened up when I was doing that big fly, with some weight on my arms, because it was dragging my arms down. Obviously,
exactly.
Physics.
Exactly. It's so gravity and pulling out.
What's your stance on that? Just out of curiosity.
Well, I would say if you look to one of the chiropractic doctors, a famous one called Andres Pina, he talks really about how to gain the movement by doing some mobility work. Now we're talking about getting the muscle into being able to control the movement of a limb at a certain angle. If you own that, the muscle would be able to have the ability to expand and contract and being stretched out.
Yeah.
And going back to the same position without being hurt.
That makes sense.
So if your muscles are tight, it's not just about passive stretching. Actually, if you get into the science of passive stretching lowers the time of the ignition of that muscle, because they have found in research that the electrical impulse gets slower after passive stretching. So passive stretching is
hold on, can we back up there? What's the electric, is this just your brain sending signals to the muscle, the joint, and the tendons, or?
Let's say, for example, I'm switching the light on. So for that switch to get on, I have to look at it. The brain sends a signal, because that is my intention, to the muscle. My limb would move, and then the action would be happening. So there's a milliseconds or microseconds where the brain orders the muscle through a nerve signal. The muscle gets activated and the actions get done. Now, if you go and do passive stretching or ballistic stretching, well, let's put ballistic stretching on the side. Let's talk about first passive stretching. If you do passive stretching before an event or before participating in a workout, the brain signal that goes to the muscle is going to get slower.
Okay.
So it's good to do passive stretching to bring that muscle after a workout into its normal position. Is going to be fine. But doing dynamic stretching is good, so you can prepare the muscle into a workout.
Yeah. So that's where I think that's where a lot of people, that's where the understanding was. But then actually some people have started to do passive stretching before. They might hold their leg back, and they'll hold it for 30 seconds, and then they'll go the other side. And actually
it's a recipe for injury.
Yeah. So that's something that they shouldn't be doing, because they're going to slow down the impulse that's coming from the brain and that mind-muscle connection.
Exactly.
Wow. So this is you're coming back on the show, man. I'll come to Bahrain.
You're
seriously,
welcome, man.
You know what?
Seriously,
I was telling Liam, we need to make a trip to Bahrain, because there's a couple of people that I want to interview out in Bahrain. I mean, mashallah, you guys have a lot of knowledgeable people out there, and a lot of strong athletes. That's something.
It's a beautiful country as well. I think we just need to go.
I know.
It's going to be our honor to have you guys in there.
Thank you, man. Thank you. It's our honor to have you in Kuwait. Seeing you at seeing you at Flair and seeing you around here it's amazing. That you come here. I appreciate it, and hopefully you never have to work on me.
Have you heard the bad rumors about it?
No. I just don't want to get hurt, man. If I'm coming to see you, that means something's wrong right there. You know what I mean?
They called me the strong thumb.
Oh man, I don't know about that. But wait, actually, that's a good question. Before we wrap up, there was another question that you had, whether we should see a physical therapist even when we're not hurt.
I did have that question, yeah. You just reminded me of that question.
Yeah, there we go.
So should we see a physical therapist even if we're not feeling symptoms of pain, or if we're not feeling hurt?
Well, if you have a trainer or a physiotherapist that is having awareness about the posture and mobility, there you got it. So it's not mandatory to see a physio if there's no pain. It's important to see someone that he has the knowledge of how the body posture and what is mobility is crucial about. So he can check you out regularly to avoid getting injured as much as possible. Now, injuries are inevitable, but you can lower down the injury percentage down to 80-85% of not getting injured just by making sure that the shoulder mobility is there, the thoracic spine, which is the middle back mobility is there, the ankle mobility is there, and the hips as well. So if you go those joints being mobile and you can own that movement in those joints, plus a good stability in your neck, your lower back, and your knees, there you go.
Yeah.
You're going to lower the percentage of getting injured. But if the question was, is it mandated to see only a physiotherapist? No. You just have a person being there, checking your movement. Now, between now and then, there you go. You're going to be fine.
See, that's why I tell kids, and I tell kids because I've coached and I've trained kids before, and even having a training certification and playing every sport known to mankind and lifting weights and bodybuilding and everything. I've always said you need someone to watch you lift because your left arm might be leading a little bit too much. Something that someone else will pick up on that you're not necessarily going to see every single time. And it doesn't necessarily have to be someone that's amazing. It's just because even new people at a sport can pick it up too. So
this is the beauty of videoing yourself now. Like you can video yourself and then send it to someone who knows what they're talking about.
Yeah, that's true. That's true.
That's the best thing.
It gives good feedback. Plus, I want to say something. Now, the interrelation or the connection, the communication between trainers, physios, probably doctors that has a respect to sports and know what the sports is and how does the athlete work, and not just going by, well, you're injured, you need a surgery. Now, it's very beautiful. And I went into such a good settlement and communication with Coach Yusuf Al-Baksami, with one of our athletes, Salman Al-Badr. He's a Bahraini.
He was at Flair, right?
He was at Flair.
He was in the lane next to me. He was right next to me. Yeah. Real nice guy. He was amazing.
He's amazing.
Great athlete, too.
Coach Yusuf Al-Baksami gives him the workout, and if there's anything that would straight come down to me, if I see something that needs to be fixed on, well, I'll tell Coach Yusuf he has 1, 2, 3, 4. The expectation of the healing process would take that much. So he would alter his own program and not to focus on getting the injury worse, and the guy recovers. Now, knocking on the wood, it's been really quite some time that he was out of major injuries. His only tightness here and there is very familiar with CrossFit athletes. But like a really major injury, alhamdulillah, knocking on the wood, it's not in there anymore. He came with a really bad shoulders back on the time when I first met him. And he got out of it a long time ago because of that settlement and that communication between the coach and the physio. So the secret of having a good communication in between the physio and the trainer is really important into the field of sports.
It makes sense.
Just to make sure that the athlete gets like the holistic approach as much as possible, rather than just the coach breaking the athlete, then the athlete going to the physio, getting fixed, then coming back and getting broken again.
It doesn't work like that.
It needs to be like a whole kind of support team, I guess, around the athlete.
Exactly. Yeah. And there's nothing such called you have to stop training, even when you're injured. Now, if you injured your back, your legs and your arms are still fine. Yeah. Now, if you injure a shoulder, your other shoulder is fine and your legs are fine and your back is fine.
Oh, this is a topic for a whole nother show, man. We got to bring you on for this. This is a topic for a whole nother show.
I swear to God, I never stop any athletes of working out. I only taper it down, tell the coach to alter the movements, and there you go. You only stop when you're dead.
A lot of doctors stop people, and on that, we're bringing you back on here for that topic.
Thank you so much.
I need you on there for that topic because there are a lot of doctors in Kuwait that especially here, they say it, surgery, don't move. And it's so wrong. And I can't wait to have you back on here. I'm not a doctor. I'm not giving out medical advice. But I'm just saying, like, people need to check their doctors and their chiropractors before they say don't move.
True.
So, it'd be great to have you back on to tackle that subject.
Can I just say one?
Yeah, go ahead.
Can I just say one thing before we end up the show? Guys, only dry needling would not solve the problem. Okay. Now, it became a fashion recently in the physio and the rehab world only to get dry needle when you're injured. Guys, if only someone dry needles you and sends you back home, okay, this is a fraud. Believe me, because there is movement, there's exercise, there's rehab, there's manual therapy. It's a holistic approach, as you said, Liam. It's not just one thing to be done, and that's it. You have to keep on the process of getting better, not only in the clinic. You spend in the clinic 45 minutes and 1 hour. You have the rest of the time till you go back to your physio or your chiro or your movement therapist. So you have to have some homework, a base strategy, homeworks based on your injury and your movement that you have to keep on and keep committed into the plan so you can get better. if you don't have something in between, you're lagging that process of getting better. So you might do something that injures you and brings you back to square one, and the therapist has to work out all over again, and that does not work. So be aware of these things. You have to have the knowledge so you can know what is the best for you.
All right, and we'll definitely tag all of your contact information in our show notes. And
thank you so much
for coming on the show. Like, serious knowledge bombs here today.
Yeah, definitely.
Serious knowledge bombs here, man.
Thank you, Mahdi, for having me. Thank you, Liam, for having me. It's a great pleasure to be with you here, guys.
Thank you.
And thanks to Project Kuwait.
Thanks for listening to this episode. If you enjoyed it, please head over to iTunes to subscribe, rate, and leave a review. You can also find us on Instagram at The Project Kuwait. Thank you, and join us next time.